You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in facial plastic surgery? With us, we have a world-renowned plastic surgeon that's right here in San Diego to discuss some of the new techniques to make you look years younger. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in facial plastic surgery? With us, we have board-certified plastic surgeon Steven Cohen. Dr. Cohen is the founder and CEO of Faces Plus in La Jolla, California. Dr. Cohen, welcome to the program.
Thank you, Randy.
Before we get into today's topic, tell us a little bit about your practice.
Faces Plus is an aesthetic facility that is a comprehensive plastic surgery skin and laser center. We're located right by the Aventine in the La Jolla University Town Center of San Diego. And we have a fabulous team of people because, quite frankly, these days I can't do it alone. There are too many aspects of facial plastic surgery that are outside of the purview of surgery.
So you're doing not just surgical procedures now, a lot of minimally invasive stuff.
I would say
combination of procedures?
An enormous amount of minimally invasive stuff.
Okay.
You know, these are the trends that are happening in the United States, and you know, when you see a patient, not everybody needs surgery, number one. Number two, people that need surgery are not necessarily completely satisfied by simply a surgical correction that removes extra skin when they have severe textural changes and sun damage and loss of facial fat and a variety of the other things that go with facial aging.
I should mention how I met you through Children's Hospital. Now, you're still involved with Children's Hospital. My son, you fixed his cleft lip palate.
Right.
And when I was told the best nose guy in the world, you know, adults and children, it was you. I mean, people do travel from all over the country to see you, is that right?
That's true.
I also, by the way, I should tell you, I go out of my way not to endorse the doctors on the show, but you are one of the guys that I've seen your work. The facelifts, in fact, we're going to show today are some of the best, if not the best I've ever seen. And the show now airs nationwide, and I want to thank you for coming on the show.
It's a pleasure.
Now, a little bit about your background, your training, and let's start there.
Well, I'm formally trained as a general surgeon. I did my general surgery at Columbia Presbyterian in New York and at Dartmouth up in Hanover, New Hampshire. And then I went on to do a plastic surgery fellowship at University of Pennsylvania. And I took advanced facial training at UCLA in craniofacial surgery, maxillofacial surgery, and facial plastic surgery.
Okay, at Children's Hospital, though, I mean, you're doing some serious stuff. Hopefully we could show and have time to show some of those photos as well.
Sure.
I mean, you redesign faces.
That's true. I run the craniofacial program, and I'm chief of plastic surgery at Rady Children's Hospital in San Diego. And we see children from throughout the U.S. and overseas for, you know, some very difficult facial disfigurement. And it's an absolute blast to take care of these kids and their families.
How does that help you, by the way, as a guy looking at the aging face of a woman in her 50s that wants to look younger?
Well, you know, Randy, you know, plastic surgery, cosmetic surgery is still surgery. It's not shopping for a pair of shoes. The beauty of having a background in a complex field like craniofacial surgery is that you transfer the surgical skills to the cosmetic patient. The beauty of having a cosmetic practice is you take the aesthetic skills that you develop there and your sense of art and balance and beauty, and you bring that to, you know, a population that really is underserved and tremendously in need of those skills. So it's a very, very nice balance, and things work together in a very nice fashion for both parties.
These photos, you know, one of the things we said off camera, I said, Dr. Cohen, I can spot, especially now that I get to talk to a lot of plastic surgeons, I could spot a facelift 20 yards away. In fact, I could spot a good facelift as well. And we kind of laughed about it. You said, you will not be able to tell my facelifts. So we pulled up the laptop, and it's true. I mean, you attract, you say, the person that doesn't want to look different. They want to look younger. Elaborate on that.
Well, it's interesting. At the initial consultation, you ask patients, especially patients that come in looking for minimally invasive or non-invasive procedures, but have more extensive aging processes that can really be addressed satisfactorily. You want to find out, what are they scared of? Are they scared of anesthesia? Are they scared of surgery? Invariably, I think they're more frightened by looking different.
Is that what they say?
That's what they say. They want to look natural. They do not want to look different. And most of my clients would be, they would be very upset at me if they looked significantly different.
You can't see a Dr. Cohen facelift walking down the street.
I don't think so.
Really?
I don't think so. I mean, I've had patients, one gentleman come back from his son's wedding and his mother didn't notice that he had a facelift.
Right.
And
But they are dramatic differences.
they're dramatic differences, but they do not look like they've been operated on.
So what's the secret, or what's the key then to a natural-looking facelift in your hands?
I don't know, because I think some of it is having an artistic eye, and I think if the good Lord decided you're going to get one, you got one.
I know you're an artist, by the way, also.
Well, I am, and I think that is a tremendous thing going in my favor.
You work with oils, water, what is it?
Mixed media, oils, sculpture, a whole bunch of stuff.
Facelifting, because we're talking about facelifting and some of the smaller procedures today. But it seems like the new buzz is minimally invasive, non-invasive. You think that's being oversold sometimes, or overstated as far as the benefits?
I think it is a very beneficial approach for younger patients and for patients that have aged especially well. I mean, there's no reason to do anything more than is necessary, for refinement.
So you offer that too, obviously.
Absolutely.
Okay.
In fact, I always start, what is the simplest, least invasive, and in many ways least expensive treatment for a given problem? And is that the most effective? The problem lies in educating a patient as to what is most effective, because marketing brings you patients that, I want a contour thread lift, I want a this, I want a that, as if they're going to walk through a black box and magically look 15 years younger.
You say you don't like marketing for that reason.
Well, it's frustrating because most of the time you spend is trying to educate patients, not say there's anything wrong with marketing, because these are great technological advances for the right patient. And if you select properly, then a patient's going to have a spectacular result from a minimally invasive procedure. If you select improperly, the patient really has extensive problems, they need a facelift, but you want to capture somehow, their finances, then you're going to have a disappointed patient, and probably, I would venture to guess somebody who's upset with you.
So in the facelift, by the way, just to define this for a moment, what are you addressing in a traditional facelift or your facelift?
In a traditional facelift, you're really looking at, it's hard to exclude the eyes unless a patient has had eyelid surgery before. It's hard to exclude the brow. You're really looking at the degree of skin laxity, the position of important landmarks like the eyebrows. You're looking at the depth of the nasolabial fold. You're looking at the extent of jowling. You're looking then at the texture of the skin. You're looking at the soft tissue volume. Has there been a lot of fat loss? You're looking at things like chin projection. Do they have good bone structure? And then you're looking at the underlying tissue in the neck. Are the muscles apart? Is there bulging of the glands in this area? Is there bulging of certain muscles in this area?
And all of those things can be taken care of.
And all of those things can be taken care of.
No neck is too far gone.
No neck is too far gone, providing the surgeon has an understanding of the anatomy and is willing to tackle those problems.
Let's start with a younger patient, younger facelift patient. Look at some of your photos.
This is a woman who is in her late 40s.
Okay.
She has increased skin of the upper eyelid. I think her brows are in good position. They have a little bit of arching as you come out toward the corner, which is very nice. She's got increased fat pockets that cause the prominence and puffiness of the lower eyelid.
Now, she doesn't look like somebody that would need a facelift.
No, in fact, she's somebody that has deep jowls and deep nasolabial folds and
what
early
are nasolabial folds.
These are the smile lines or the creases right here, and she's got some early jowling. This is a very nice candidate to do minimally invasive facelift type surgery.
Okay.
So in addition to doing her
So
eyelids,
minimally invasive facelift surgery is what, again, for this woman?
It's a hodgepodge of names, some that are recognizable, like the lifestyle lift.
Okay.
You know, that's nothing more than a straightforward mini facelift that, you know, keeps the incisions right in front of the ears, just slightly behind the ear, limited skin dissection, manipulation
So
of the
addressing the
underlying.
lower face.
So it's addressing really the lower face with some improvement in the neck. She has no problems in the neck. That might be a very nice option for her.
Were her fears, obviously, she didn't want to look different.
She didn't want to look different.
Or
Nobody,
stretched.
right. Nobody wants to look that way. At least
Okay.
they come into our practice.
Right. Okay, so her after. Let's take a look at that.
So here's her after, and you can see she has a very nice natural look.
That is about as good as it's going to get.
And she doesn't look different.
She
looks
looks
better.
rested.
She looks rested.
She looks about 10 years younger.
She looks enhanced, yeah. Not as dowdy.
So this woman, you didn't touch her brows, but you did her neck.
We did a mini facelift, which improved the jowls, and we did an upper and lower eyelid surgery.
Upper and lower. Now you say with eyelids, and I'll quote you, less is more. What does that mean?
That's a tricky one. I think eyelid surgery is going in two directions.
So we're talking about the little skin above the eyelids.
Right. It's more complicated than just the little skin above the eyelids in most patients. For instance, in a man, you know, having a little extra skin above the eyelid looks nice. You know, if you take too much out, it may feminize their features in a way they're not comfortable with. So you have to be very cognizant of...
I see a hollow look quite a bit, especially on females.
Oh, and I think that is related to a couple things. It's related to sometimes not recognizing functional problems with the eyelid. So it's important to analyze where the eyelid sits relative to the pupil of the eye. And I also think it's important to realize that taking too much out is going to leave them too sculpted, too hollow. Taking too much fat out is going to leave them too hollow.
I saw a woman, I told you, and she had this done. She's 40. Now she looks like a beautiful 55-year-old because they took too much skin.
Yeah.
She looks done.
Some of that is reversible.
Oh, is it?
You know, some of that can be fixed, you know, with a more reconstructive approach.
Now let's go to a few photos.
This is a woman who felt that she was beginning to develop signs of aging around her jowls, some early signs of aging around her neck, and, you know, kind of a tired appearance around her eyes.
She looks a little tired.
And she looks just a little tired. She feels a little bit tired. And she's interested in a sense of rejuvenation. And in my opinion, this is a woman who's an excellent candidate for, you know, eyelid surgery, a facelift. And in her particular case, because of the depth of the smile line, this is not always corrected by facelift alone. And so in her case, we used fat that was transferred from her abdomen into the folds around the mouth.
Okay.
And that was our game plan. Now, we did not address her brow. She has some arching of the brow, which is a nice natural look. She doesn't have a lot of extra skin outside of the corner of the eye, which really does often require a brow lift to treat. And, you know, again, just more of a generally tired appearance. So take a look at the after, Randy. This is a woman who's now had a full face and neck lift with fat injected to the smile lines or the nasolabial folds. Eyelid surgery.
She looks like the daughter of the first one.
She does.
I mean, she could be.
I think it's a very nice result. It's very natural. Nobody is going to say to this lady, "Oh, look at that facelift." She's not going to feel self-conscious walking down the, you know, aisle at the grocery store or going out to a party with friends.
And do patients come in a lot more educated today because of the internet? They come in and they diagnose themselves, I want a facelift?
They come in very educated, and some, it's terrific to work with them because, you know, they already have a vocabulary. Others come in just armed with, you know, a whole bunch of marketing nonsense.
Like S-lift, this lift, that lift.
And, you know, and so you spend most of your time educating them what the specifics of each of these techniques are.
So those things aren't new, it sounds like you're saying.
They're not new at all. They've been around forever.
They've been renamed.
They've been renamed and
to create some sort of a
marketed.
niche?
Yeah, a niche or I mean, it's a business these days.
But you are better at doing a facelift today than you were 15 years ago. I mean, there are some changes.
I think there's some really nice changes. I think that.
What are they?
Well, I think they come in two schools. One is less invasive for patients that require less invasive approaches. And the other is more invasive, where we're manipulating the underlying tissue in addition to redraping and trimming the extra skin.
Okay.
You know, so that the skin itself is not going to be windswept. You're not going to have an unnatural appearance because you're not just using the skin to create the lift. You're really using the underlying tissues, which go in a very different direction than the skin does.
So picking the surgeon is very important. And I'm not trying to side with you, but I've seen your photos. Picking the surgeon is important. I mean, if a woman is 50 or a man is 50, they're going to look at their face for another 50 years or 45 years. You've got to pick the right surgeon.
Well, I think that's a very important component. It's not like shopping for a pair of shoes or a dress. It is very important.
So what should you look for? Obviously, you're biased, board-certified plastic surgeon.
You know,
I mean,
well,
photos, is that the key?
Photos are a little misleading because all of us are going to show our best photos.
Okay, that's
now, of course,
honest.
If you have a discerning eye, you know, you're going to look at somebody who's showing you their best photos and go, that's not so great. By the same token, I think that it also gives people a sense of reality because not every result is model greatness.
Yeah.
And it's important for patients to understand improvement, you know, is really critical. Sometimes patients are upset after a perfectly excellent facelift, and it's not until you show them their before picture they went, oh my God, I look like that. Because now, you know, they're looking at themselves again and they're going, but I still have a little of this and a little of that. Well, a little of this and a little of that makes you look natural. So it's important to remind patients, here's where you were a month ago. Here's where you are now.
How did you get the reputation as the guy, the surgeon that gives the natural looking facelift? I mean, did it start with one prominent, you know?
I don't know it's any reputation you seek out. I mean, I've always been very involved in medical and surgical research. I'm an inventor. I have patents. I've written, you know, close to 200 papers.
I mean, everything we're talking about, you teach plastic surgeons.
I do. I'm just, you know, I'm a driven person, and you know, for your patients, you want things to be excellent.
Are you a perfectionist?
I'm an absolute perfectionist, but unfortunately, the one thing I know every day I can count on
What's
that
that?
I'm not going to be perfect again today. I'm
Okay.
just going to try very hard to be.
Let's see another.
Okay, Randy, here's a lady, I think she's a good example. This is a
Now,
woman.
that's a pretty woman already. She said, I mean, she wanted a facelift.
And you know what? It's great when you have a pretty woman like this. The key is not to make them look unpretty. I mean,
That happens.
all you can do with somebody that is attractive is get too fancy. And if you get too fancy rather than keeping it simple.
Interesting statement, too fancy as a surgeon. What do you mean by that?
You know, somebody comes in and you know, they heard about this new endotine cheek lift. Well, an endotine cheek lift could be a perfect operation for some patients.
So don't let a patient make a
And
mistake.
it could be a terrible operation for others.
Okay.
So it's highly individualized based on their appearance, their anatomy, and what they're trying to accomplish as their goal. But if they want to look like themselves but 15 years younger, you don't want to get too fancy. You want to keep it simple
All right.
and straightforward.
So with this woman, what did you see, by the way? And what bothered her?
She was bothered
great.
by just kind of like, you know, tired appearance around her eyelids, some extra skin of the upper eyelids.
Her neck is an older neck.
She was bothered by, you know, the appearance of her neck and some of the jowling. I think those were her main concerns.
So what'd you do?
So we did a full face and neck lift on her. We used an approach where the underlying tissue called the SMAS, or superficial muscular aponeurotic system, SMAS, was manipulated to create more of a lifting effect and to define the neck.
Now that is a fantastic
And then upper and lower
look.
eyelids.
So upper and lower, no brow lift.
No brow lift.
Interesting. And her neck in the after is a youthful neck.
You don't see all the crinkling, you don't see the muscle bundles. It's a youthful neck. And
But you know what we've said, I mean, if I saw that woman walking down the street, you
You'd
wouldn't
never-
think anything. You would just
No.
think that's a
normal,
healthy, very beautiful woman.
Right, exactly.
And that's what you want.
That's what they want. I love it Because
Okay.
to me, that is the
And
easiest
your eye
to produce.
picks up, may not notice that's a great neck, but it's associated with youth, obviously.
Yeah, no question.
So what does this woman say to you? I mean,
Well,
she had to be
she's-
very pleased.
She was very pleased.
When could she go back to work? If she wanted to work?
Usually somewhere between 2 to 4 weeks. Everybody recovers slightly differently, but I would say most people by 4 weeks are ready to be in public. But you know, a number of people, and I'll show you another example.
Now this woman, by the way, and I keep talking about this woman, before and after, she looks like a model in the after.
Yeah, she looks terrific.
I mean, she looks like a 30-plus model
Yeah.
that could be on the cover of a health magazine.
Yeah. This is another example of a woman. She's in her late 50s, and you know, she just, you know, she's taking care of her family. She's taking care of everybody but herself in some ways, and she's at a point in her life where some of these things might have become important to her. So she's come in. Her main concerns are her neck, you know, her jowls, a little bit around her eyelids.
Now, I don't look at people this closely normally, by the way, but I could see that old neck. I could see the loose skin around the jawline.
Yeah, but yet you see a beautiful face.
Yeah.
And, you know, again, these are...
So she's a facelift patient. When you see her, that's ideal candidate.
This is an ideal candidate.
So the after is
And this is the after, you know...
happy, vibrant. Look
you know,
at that.
and just, you know, I think a mature but very youthful, full of life type
That's a
of
pretty, I mean,
patient.
that's a sexy woman. I mean, that's a pretty look.
I would agree. I would agree. She's a very beautiful lady.
What do their friends say? I mean, how many years younger? I mean, what do you hear as a doctor where the husband may say, my wife looks 15 years younger?
I think that generally 10 to 15 years are things that we hear quite frequently.
Okay.
You know, I think that husbands are wonderful. You know, boyfriends, husbands, I mean, they're very supportive. You know, they don't make the decision for these ladies. These ladies,
Good.
they make their own decisions, which is the way it should be. And I would say that most spouses are incredibly supportive. They're thrilled for the wives to feel better about themselves. I mean, they're thrilled.
Now, we are out of time. We haven't talked about noses. You do a lot of nasal surgery. A word on that?
Well, I would say it's an operation that's taken me nearly 18 years to get really good at.
Is that right?
And I
A
can
lot of
tell
guys
you,
don't like doing noses, I found out.
No, a lot of plastic surgeons don't. And I think it's one of those areas, it's so visible. It's like, you know what it's like when you have a pimple on your nose. You think the whole world is staring at you. And the thing is, you know, as giant as a red balloon.
Right.
So you can imagine if you don't like the appearance of your nose, you know, it's the same kind of thing.
A natural look, though, as well.
A natural look, and as soon as you make the nose look like it fits the face, all of a sudden you go, wow, look at that pretty face. Whereas before you're looking primarily at a nose, and minor changes can make very dramatic impacts for patients. But it's also an operation fraught with, you know, technical problems and poor outcomes.
Now,
Yeah, I
weak
think
chins, I guess, in older and younger patients.
older and younger patients, a few critical things. One, in an older patient and even in a younger patient, you need to make sure they have no sleep apnea. Because frequently the chin is associated with a recessed tongue, and that can lead to airway problems. So you have to be a medical doctor first.
Okay.
Two, oftentimes a weak chin is associated with a weak lower jaw, and you need to give your patients the option for jaw surgery because these are excellent techniques in today's world.
And these are things you do routinely.
I do these routinely, and it's very helpful to make those diagnoses appropriately. And I have to give credit to my colleagues in town because those that don't do it will frequently refer to those of us that do within certain realms of practice. And so it's very important to assess the chin in the context of the bony skeleton. Once you've made those assessments, then there are two options. One is a simple chin implant, which works beautifully for patients that just need minor augmentation, and sometimes works very nice for kind of a tight chin, a small chin that's also a little weak.
Of all your photos, the chins seem to make the biggest difference.
Most dramatic
Not even the same people.
Most dramatic operation.
Especially
you can
for
do.
the kids.
Absolutely.
And
the techniques we use, you know, often are techniques where it involves cutting the chin rather than putting an implant and moving the chin forward or up or down or rotating it, to address the subtleties of the abnormality, because there's not a single approach to chin surgery.
We are out of time, but a word on the kids. I mean, because you change their appearance when they're born with severe problems, facial problems. What do you say to a parent, I guess, that has some of these problems?
I tell them not to worry.
Okay.
I tell them that they're going to be amazed at what can be done today to improve their child's appearance. And
I mean, even bulging eyes.
Things where the children unfortunately look like monsters, you can almost make them look like normal people. That's why I went into plastic surgery, to do operations of that magnitude and make those changes. And it's like sculpture. It's an amazing event. The types of bone cuts are incredibly dramatic.
I mean, you're cutting skull.
You're cutting skull, you work with a neurosurgeon.
Does that make you not more aggressive, but less fear when doing a routine facelift?
I think it makes you much more confident as a surgeon. I mean, if you're managing, major blood loss with patients that could potentially die on an operating room table, with
these kids, with some of these major surgeries,
that translates to a very safe atmosphere when you're doing cosmetic surgery.
All right. I want to thank you for coming to the show. Very good.
Thank you, Randy.
Always a pleasure.
Vice versa.
And the photos are just absolutely fantastic. In fact, if anybody is considering a facelift, they should at least visit you for a consultation or look at some of these before and afters. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.